Morning, Dr. J back again with the Human Movement Institute, where we have improvement through movement. Today we will be treating the cause of human movement diagnosis, lumbar flexion and rotation syndrome. Any impairments in the body that causes that repetitive, excessive motion in the spine is the very reason and cause of the breakdown or the changes that we see in the spine. To treat some of these impairments, to loosen the hips and or structures that connect to the pelvis that crosses the hips and knees, is a supported neutral spine knee over toe exercise. This is a gentle movement to help loosen the back front hip while improving the bend of the knee that's forward. This also improves hip flexion. The more hip flexion you have, the less lumbar flexion you have. It also loosens the soleus and restores dorsiflexion of the ankle, which is known to be, if limited, causes arthritis in the knees, and people with limited dorsiflexion are way more likely to get knee replacements. So this easy movement can be done 10 to 20 times. Dynamically, repetitiously. You can also straighten the back leg and hold a static stretch with dynamic movement to open the front of the left hip. I would do both sides, but we would need more in some patients with the right foot up, okay? After this movement, we'll be able to come to the ground and find hip openers, particularly with the left hip. And again, dynamic. If you have limited left hip external rotation, you can keep the spine neutral, engage the core as you look right and left as we improve the opening of that hip. We're also getting front hip mobilization as well. Warm-ups are best done dynamically, not statically. Next is neutral spine. Am I rounded or am I arched? Neutral is in between, then navel to spine. One of the best movements for long-term spine health is the bird dog exercise. Here I'm holding for 1 to 2 breaths, building up to 3 to 5 breaths. We can relax into a wide leg child's pose to loosen the hips and buttock while preserving the spine or preventing overflexion of the spine. Give yourself a break, and then we're going to repeat 3 to 5 times on each side. This is a daily movement I personally do, and when patients ask me what one thing can I do for my spine health, this would be it. Next is bridging. Bridging in patients who have normal or excessive hamstring flexibility with tight quads can lead to cramps. So at first, we're mastering neutral spine. So feel the arch, feel the flat, and back off a smidge. That's neutral. Next is navel to spine. It's totally okay to start with lower lifts. Hold for 3 to 5 seconds or 1 to 2 breaths. Initial starting dose, 3 sets of 10 to 20 reps. As this becomes more flexible and this becomes stronger, we'll find that we can get higher without the cramps. If we do get cramps, stop, glide the hamstring and sciatic nerve 10 to 20 times and come back to it the next day. You can also elevate your heels up on like a 6-inch step or block, and that helps decrease hamstring cramping. Long term would be, as this improves and I can get higher, I get stronger hamstrings, looser hip flexors, stronger corset core. And then cool down for patients with one quad that's tighter than the other is the standing quad stretch. Just be careful you don't cramp. You can use a pant leg or you can use the back strap of a shoe. The longer you're holding this, the more likely we'll cramp until this becomes more flexible. Here's where static stretching matters. Cool down helps prevent the tight from getting tighter. So the last thing we want to do is a standing quad stretch using the hand and arm, not the hamstrings. This would be a true passive stretch. Right side until the right equals the left. Hold 1 minute. Give yourself a little break with some spinal self-distraction and repeat 3 times. This concludes our beginner level program. Thank you.